Welcome. This week we're going to be talking about chronic disease, complementary alternative medicines, and technology as they relate to health promotion and prevention. There are a couple different types of care provisions that I wanted to introduce to you. You're very much familiar with what conventional medicine is, and I found this really cool slide to help you get a stronger understanding that conventional medicine is not the only type of care that we are able to deliver. In the AG program, we are a health focused program, and then we bring in the disease. So we look to see how can we actually help this person stay healthy? How can we optimize their health, and how can we do that? And by doing that, we can prevent diseases from happening. So as you can see on this slide, we've got conventional medicine, what it typically is. Then we've got alternative medicine, and alternative medicine and complementary, they are different. They're not the same. So I wanted you to be able to understand the differences between the two. Alternative, we could use in place of conventional. We are still going to be using medications, but they may be more closely associated with natural products. And not all elements that are included in alternative therapies are actually evidence-based, and that evidence supporting what their claims are for health benefit. Complementary medicine uses a holistic approach in caring for the individual. It's more modernized in that it will utilize aspects associated with assessment coming from conventional medicine. And then we're going to bring in different aspects of alternative, more of that natural component, and incorporate in not just medications, but other types of healing processes. Then we have integrative medicine, and this is a combination both of a pharmaceutical, natural perspective. It works with biological, it works with mind medicine, it does energy, and the intent and purpose of integrative medicine is to strengthen that holistic view of that human, trying to work with the areas that are truly out of balance in that human and bringing them back into balance. And functional medicine, you're probably hearing quite a bit about this because I've been reading a lot about it. This is actually looking at the functions and how those functions get out of sync and then bringing them back in sync. It is evidence-based, and it has a very, very strong focus on prevention and working to reverse versus than doing a treatment for a chronic disease, though we can do that, but it looks to support the body and to work to improve areas of the body that may become out of balance. With complementary and alternative medicines, these are the five main categories. We have the biological, where your herbal supplements and food sources and nutrition base is going to be. We've got the manipulative and body-based, so massage, chiropractic, osteopathic. The mind-body, pretty explanatory there. We have the alternative. This is your homeotherapy, traditional Chinese medicine, Ayurveda, and acupuncture will be in here. And then we have our energy therapy. Reiki is one that I think you're probably familiar with, along with therapeutic touch. And any one of these can be utilized, or they can be used in combination as complementary alternative therapies to treat disease processes, or as preventative aspects. Let's just use stress. A person has stress, we want to prevent it from getting any worse. We can employ an alternative therapy as well as a manipulative body-based therapy, mind-body as well, and try to help this person deal better with their stress and keep that stress from causing other disease processes. I really liked this image and I wanted to share it with you because it really provides you with a good visual of so what kind of things live where and what type of complementary alternative medicine would be best to use for what type of medical problem. So take a moment. I'm going to stay on this slide for just a few minutes and just look at where some of these are living at. So they are divided up into the categories, but we have our energy, our mind-body, our manipulative, our biologic, and take a look at where some of the disease processes live and what types of complementary treatments we can do to help these individuals if they choose to engage in them. There's a lot of discussion occurring about functional medicine and conventional medicine. Remember that conventional medicine is a disease-based platform. So typically with that disease base, a person normally doesn't come in for care or doesn't seek care until something is happening or a symptom is present. With functional medicine, it's the opposite. We're trying to help that person not have disease processes and work to keep the body balanced without symptoms. And we work ahead of the diseases so that they don't become prominent, if you will. And what I mean by that is the risk of them occurring per statistics. With functional medicine, we try to push that risk down. So this is the patient, and you can read the scenario. And for conventional medicine, for this person with high blood pressure, the first thing that we may ask them to do is, try and lose weight. But depending upon where that blood pressure is, we may start giving them a blood pressure pill, maybe a little water pill like hydrochlorothiazide, or we may use a beta blocker, or we may use an ACE inhibitor. In functional medicine, we're going to look at what components of their lifestyle could be contributing to this. So the example provided for you here is a lot of people eat a lot of processed food, which has a lot of sugar. Sugar produces a lot of inflammation. That inflammation retains fluids, and those fluids can lead to hypertension. So they work on adjusting the nutritional balance first. If the person has elevated cholesterol, they've done 6 months of lifestyle management, it's not working, we offer a statin. In functional medicine, they're going to start running very intensive testings on the thyroid gland and checking out the thyroid gland and making sure that thyroid gland is functioning at its maximum capacity, and make sure that the supportive component of the pituitary gland and the adrenals are also working appropriately. They will work to improve their function versus starting a medication first. If a person develops diabetes in conventional medicine, type 2, again, we're doing lifestyle modifications, looking at loss of weight and nutrition. If they're not successful, we will then turn to a medication. In functional medicine, diabetes, if the first two are appropriately done, so we have the elimination of sugar and we have proper, let's just call it endocrine function, that person shouldn't get to a diabetic state. Now, if they genetically are predisposed, that could put them there. Or if they're taking an over-the-counter supplement, or they've had significant stress occur, which has undermined the endocrine system, then they could start running some higher sugars. They may be suggested to them that a medication could be utilized. It may be a homeopathic product before it may be a actual prescription type product like an ACE inhibitor or a beta blocker. For blood pressure, they don't like to use things for a long period of time. So if by chance the person is not successful with eliminating those sugars, getting some weight off, the endocrine is working properly, they will supplement with a prescription medication, but they don't want it to be long-term, like 4 or 5, 6 years, like we see a lot of times. They really want those people to come off of them and those medications, and they work with them through that lifestyle modification to get them off of medication if they possibly can. A lot of times for inflammatory processes and for pain problems, we will institute the use of medication, nonsteroidal anti-inflammatories. Those in themselves actually can cause problems within the human body. They affect the kidney, they affect water retention, and they can affect the platelets. In a functional medicine format, we really want this person to maximize their body's anti-inflammatory processes that it normally manufactures, and exercise is one of the main ways to do that, along with nutrition. And then we have our mind body. We all know what stress does to our body. People will start developing GI symptoms. We will turn to over-the-counter medications such as antacids, H2 blockers, or PPIs. In functional medicine, they look to work with the root cause. If they're unable to stabilize through that means and manner, they may utilize medication, but they really try to stay away from that and have the person work homeopathically. The two main differences of conventional and functional, if you want to put it in a capsule, is functional medicine puts self-responsibility of personal care on the patient, and conventional medicine doesn't necessarily do that. So we're going to move into obesity, and you guys are well aware of obesity and the different types of problems that we're seeing with it. I'm just going to be going over it just briefly, but I wanted to remind you that obesity is actually defined through a BMI score, but that BMI is composed of a couple of different elements. So that body mass index score is composed of your subcutaneous adipose tissue, your visceral adipose tissue, your skeletal muscle, your bones, the fluids, and any type of inflammatory process that's occurring inside the cells. Think of those cells as expanding and getting bigger because they're holding onto the fluid. So BMI is not just thinking about fat, muscle, and bone. It's everything about that human body. And that BMI literally does fluctuate as the person's health fluctuates. A lot of factors will come into play that can promote the development of obesity, or let's say promote weight gain that can lead to obesity. One of them is chronic sleep loss. Stress produces a lot of insomnia. And if a person isn't getting 6 to 8 hours of sleep, they are indeed affecting their body's ability to repair, which we learned earlier about in this course. Well, now it's coming forward here as one of the proponents that causes people not to lose weight, gain weight, and leading into obesity. The types of foods, and we learned that last week, the sugar contents that we have, the fats, the types of fats that we're eating, and one of the ways that we can work to combat weight gain and obesity is to eat more fruits and vegetables. So looking at that Mediterranean diet or that DASH diet or the flexitarian or Weight Watchers, using one of them to help with this. Stress and psychological stress, think about what we've learned about that previously, especially about the antioxidative state that occurs in the body, the free radicals that occur, the cytokines, the adipokines, all of these leading into higher inflammatory responses in the cells and causing the cells to become inflamed. And then we have medications. And there's a lot of new medications, atypical antipsychotics that are on the market right now. You're seeing a lot of them. Vraylar is one. These atypicals, along with your SSRIs and your NSRIs and steroids, these can change how carbohydrates are metabolized and stored in the body, and people who are taking these type of medications actually are at a 50% risk of gaining anywhere between 8 to 20 pounds, and this can occur over a 1 to 3 month period. So it's really important to get a history on these patients, if they've ever used one of these medications before, on what happened in relationship to their weight. I know that you are familiar with the BMI index. I wanted just to bring it forward in case you hadn't been. We do have an ideal body weight. Now, this ideal body weight actually can differ depending upon what country you're living in and ethnicity. So there can be differences in this in relationship to that. But it is based upon height and weight and age. So you can take a look at the chart, see if you can find yourself, and if you can, How are you looking? Are you doing okay? Are you having any problems? Are you in the overweight category, or are you doing just fine? And it's important because patients will ask you, how do you know? How do you know when your body is gaining too much weight? What do you feel like? Well, there's a lot of different things that a person can feel, and you've experienced your own. And if you've never been overweight and you've been underweight, how have you felt? What does it make your body feel like? Different things just to keep in mind as we work through and try to gain better understanding in working with our patients, some of the reasons they may feel the way they feel. Body mass index. Take a look at this one, a little bit more structured. So we have underweight, healthy weight, overweight. And then we have different categories of obesity, obesity 1, obesity 2, and we have obesity 3, which is the morbidly obese. Give you one more look at that. And there actually are individuals who are in this gross obesity category. That's all your red. And we have quite a few individuals who have that. A reminder, a BMI of under 18.5 is considered underweight, and a BMI of 25 to 29, you're overweight. 30, you're obese. Our, I'm going to call it our golden ticket area, is to identify and help people when they are overweight to get back to that healthy weight. The adipokines, the free fatty acids, the inflammatory markers that are occurring. This cellular insulin resistance produces more fat. People gain weight. They get endothelial inflammation. We start having other medical problems occur along with it. We have to stop the cycle. This table is really mind-blowing when you look at it, but it really keys in on the adipokine and the different types of adipokine. And when those adipokines become dysfunctional, what can happen? So just look at leptin. Its the primary source is the adipocytes, but look at its function. Leptin's function is appetite control through the nervous system. So if we have a large amount of adipocyte dysfunction occurring, then we're going to have dysfunction of leptin. So the appetite control center in my brain becomes dysfunctional. Think about stress. What do people do when they're stressed? They eat. Why do they eat? What's promoting them to eat? The dysfunction of the receptors in the brain. So resistant, it promotes insulin resistance and inflammation through your markers. So we don't want resistant to be there. And again, the more adipocytes you have, the greater you have of resistant, the greater amount of resistant you have, the greater is going to be the insulin resistance that occurs, and so on and so forth. Take a moment and look at the actual adipokines that are listed here and what their function is. It's pretty impressive when you actually look at it. And it's amazing. It all starts with just a change in chemistry. And that chemistry can be controlled. And we control that chemistry through exercise, nutrition, and stress management. So let's take this one step even deeper. Let's look at the relationship of obesity and chronic disease. We know it exists, but why does it exist? It goes back to that adipokine. The slide on the right-hand side shows you what happens with the normal slides when the normal metabolic function becomes changed or inhibited, and think of that insulin resistance that begins to occur. We get inflammation, so here come your macrophages. The adipocytes become accelerated. We start having CDT4 cells coming up, and we start developing inflammation. Got it. So the adipokines are your pro-inflammatory agents, and these are linked to inflammation of the cell and the endothelial linings of our blood vessels. Go to the slide number 2, obesity with mild metabolic. We have increased inflammation. That decreased metabolic control is because of the insulin resistance that's developing. Look at what's happening to the cells. They're getting bigger. Look at the number of, I'm trying to think for a second. Look at what's happening with the adipocytes and look at what's happening with the macrophages. They're increasing. To the last one, now a person is becoming obese. They have more inflammation, so the cells are swelling, more metabolic dysfunction occurring, so greater insulin resistance, more macrophages, which are leading to more inflammation. CD4 T cells are coming up, and now we start getting a death of cells, which is releasing other types of pro-inflammatory markers. And now the process has started and it's very difficult to stop. So the diseases that we know can come from inflammation and can come from cell swelling, hypertension, diabetes, high cholesterol. Stroke will happen because of the endothelial inflammation. Heart disease. Heart disease is an inflammation of the endothelial lining. That inflammation now becomes the perfect platform for plaque to lay down, and that plaque becomes hard and firm, and there can become a rupture in a plaque, which can lead to the development of a thrombus, and that thrombus can lead into complete occlusion, and that complete occlusion can lead to death. We have been talking quite a bit about cancer and nutrition, and cancer and inflammation that occurs because of it. So we're talking about the methylation and the histones and the ligands changes that can occur. Again, all of this is controllable. And arthritis, increased wear and tear, plus inflammation on the joints. Taking a look at, okay, now we've got a little bit better understanding about what underlies obesity. So where is the greatest disease processes occurring? Well, it's your cardiovascular, no-brainer there. The endocrine system, this is going to be that insulin resistance and type 2 diabetes, liver and kidney dysfunction, secondary to inflammation, respiratory diseases. This is going to be sleep apnea, which is going to compound liver and kidney dysfunction, which is going to compound endocrine disorder related to thyroid, and will affect the heart by the heart becoming tachycardic as a rebound response. The nervous system, whatever happens inflammation-wise in the body as a whole is going to happen up in the brain. You just can't see it. There are more digestive system disorders in non-obese people than in obese people. And then there are surgical operations that will occur more in obese people, like gastric bypass surgery, gallbladder surgeries, knee replacements, and so on and so forth. If we just worked harder on nutrition, exercise, and stress management, we could probably cut this, according to the literature, by about 35 to 45%. That's pretty big odds. Arthritis is a big problem as people age, especially those who are obese. And osteoarthritis is wear and tear, but remember that inflammation is a huge part of obesity, and that inflammation isn't just endothelial, it could actually affect joints as well. And that metabolic inflammation of the joint accelerates the joint degeneration, where a person may need a knee replacement sooner if they wouldn't have been as overweight as they are. Remember that inflammatory process is a key element when we're talking about osteogenic changes. Over to your left on the bottom of the screen, we have the synovium and chondrocyte-derived inflammatory mediators. This is your cytokines and your chemokines. We've got your microRNAs, your acute phase components, and there's those darn adipokines again. These all interplay in whatever is going to be occurring with those adipose tissue-derived inflammation mediators are also going to be stimulators for the synovial. So when we think about obesity and complementary and alternative medicines, we just finished going through the nutrition and the exercise modules, and you learned intently about the Mediterranean diet. You learned about the DASH diet, the flexitarian diet, the anti-inflammatory diet, and Weight Watchers, as well as low cholesterol components of each of those. That is where we're going to start working with obesity. Now, there is an element associated with nutrition, and there's no way that I'm going to be able to say that word, but it's called DAG. And DAG is a oil that has been found to be very effective for fasting and postprandial hyperlipidemia and preventing conversion into adipose tissue. And we'll talk a little bit more about this DAG product. Acupuncture is really good. It changes the energy transmission between the neurons in association with the leptin, which is very helpful. And then we have hypnosis. So DAG is a oil, and it is available on the market. It is called Innova, is the brand name of it. And what DAG does is that it is a combination of different types of oils. And this combination of different oils in the body helps the body work better. So you would use 1 to 2 tablespoons of DAG to cook with, and in doing that, this is the profile that you could see potentially happen in that individual. It's pretty impressive. It can decrease triglycerides, increase HDL, decrease total cholesterol, and decrease the LDL. It's amazing what this can do. It also helps to lower hemoglobin A1C, and how it does it is because you're not able to absorb that amount of lipid product from the intestines, so the body doesn't try to break it down and use it as energy stores, and it brings down the glucose. So this is how it works. So it's an oil that gets into the intestine. It breaks down, it's broken down by a lipase enzyme and separates the fatty acids. The absorption goes into the cells, it rebuilds the lipase enzymes, and then the free fatty acids are burned off in the liver and excreted. The energy is burned, not stored as fat. And that burning mostly happens in the intestinal tract. Some of it does happen in the liver. This product is very expensive. It's not cheap. I did find it, I think I found it at Sprouts. I found it at Sprouts and I found it at Whole Foods. I have not seen it at Safeway or King Soopers. I did not see it at the Natural Grocer Store. I did not see it at Trader Joe's. Okay, but it's made from natural soy and canola oils, and then it's combined with an enzyme. And that enzyme that it's combined with is what makes this effective. So it is something that a person can do. I do believe I saw this, I think it was $11.99 for like an 8-ounce bottle, something small, but it isn't cheap. Can a person do this and not take a medication? This would be part of the lifestyle modification that they would do, that 6 months where they're doing lifestyle modifications before medication would be offered to them. This would not be technically something that we would have them do along with a cholesterol lowering medication. It would be part of that 6 months lifestyle modification. We're going to talk a little bit about green tea. Green tea has a lot of polyphenols, and those polyphenols are very helpful for an individual. Green tea does have the ability to have people lose weight, and they are able to do that through the activation of the nuclear factor erythroid 2 related factor 2 and that pathway inside the human body. It does an upregulation of the neprilypsin, and it prevents gut dysbiosis, which that dysbiosis, you guys, of the gut is a really big thing. We need strong gut health or intestinal health to keep our bodies in balance. And when our intestinal balance gets off, it can predispose us to all those same diseases we saw in relationship to obesity, plus others. And green tea, it it has to be green tea. It can't be a combination of a little bit of black tea and a little bit of green tea. It really does need to be a green tea derivative and made into a tea, and it needs to be drunk at least 2 to 4 cups a day in order for it to have this effect. Now there is quite a bit, not quite a bit, but there's about, I think it's 35 milligrams of caffeine in green tea, and that can produce a stimulation effect to the human body, cause tachycardia, cause them to have some hypertension. So it's important to understand, if you're going to recommend green tea to somebody, you need to know what their comorbid risks are associated with it. So in integrative health and medicine, green tea is reported to be able to help with this, but the research related to it is inconclusive that it actually has been shown to be beneficial. Calcium, on the other hand, 800 to 1,200 milligrams a day, has been shown to increase weight reduction and fat loss. And typically this is going to take about 6 months to do. Now, it's interesting that the literature is showing 800 to 1,200 milligrams a day, but our human body is not going to use that full 1,200 milligrams. It's only going to use enough to reach a level of appropriate concentration in the body, and then it's going to excrete the rest of it. It will not store extra calcium. It will get rid of it when it's given in this manner. Now, it says dietary intake of calcium. This means eating food products that have calcium, not taking a calcium supplement, eating these food products. So you have to be looking at what type of food products contain calcium and how much is in each of those food products. And I tried to do this and get 1,200 milligrams in just to see how much food I would have to eat. So in order for me to actually do this, I would actually be eating pretty close to 2,500 calories a day. I didn't do it for a long period of time, but that was a lot of calories for my body, but it can be done. So here are some food sources of where you can find calcium. Take a moment and look at the amounts and look at the type of foods. Some pretty interesting sources. So we know almonds, 22 nuts. We know that 10 nuts is 100 calories. So 22 nuts is going to be about 220 calories. What's pretty good though? Our whey proteins, which we had talked about previously, they are an excellent source, and they can provide us with about 20% of our recommended daily intake of calcium, but they're not going to give us all our calcium, and that's proportion. So, having a protein drink in the morning. Cow's milk, if I drank 3 glasses, 8-ounce glasses of cow's milk a day, I could do that dietary intake. I could do that. Now, this is whole milk, or it can be non-fat, not 2% or 1%. And a lot of the milk has a calcium supplement in it. That supplement does not count. It needs to be a whole milk product that has not been supplemented with a lot of vitamins and minerals. So we've talked about obesity, and obesity is one of the characteristics of a medical problem called metabolic syndrome. And metabolic syndrome is a constellation of a number of medical problems that a person has. Obesity is one, high blood pressure is another, high glucose is another, or pre-diabetic, where the hemoglobin A1C is above 5.6, and they have abnormal cholesterol. Those 4 elements together are called metabolic syndrome. And if you think about what I just explained to you about obesity, that makes complete sense. It makes complete sense in relationship to all of these elements of disease that are listed all reflect back into the adipokines, the adipocytes, the insulin resistance, and the endothelial inflammation and cellular inflammation processes. This is workable, doable, and reversible. So how do we know what it looks like? Well, I've provided for you here a really cool table that helps to explain it out. So first of all, we do need to have central obesity. Triglycerides, and you can look at a chemistry panel and everything looks really good on that panel. Everything is a normal, but you see the triglycerides are maybe just slightly elevated or more than just slightly. Maybe they're 20 or 30 points up. And then you take a look at the glucose, and that glucose could be running 101 or 102. When those triglycerides are elevated and you've got just a barely elevated glucose level, that person has insulin resistance. Triglycerides tie right into the glucose level for labs, and if you have elevated triglycerides, they've got a metabolic syndrome beginning to happen. They've got glucose issues typically happening. HDL can be down, blood pressure is going to be up, and their fasting glucose will be a little bit up. That hemoglobin A1C, remember, is going to give you a reading of 3 months of glucose values in the body. So we're using that as our gold standard now for assessment. We just get snapshots when we run glucose tests or we're doing a CMP or a BMP. But these elements together demonstrate to me, they're at risk or they do have it. This is a pretty busy slide, but this is what happens inside the body in relationship to metabolic syndrome. Take a moment, really look at this slide, put your brains back into what we were just talking about in relationship to obesity, and you actually see the chemical process of obesity embedded in the process that leads to metabolic syndrome. It's here. Go on down to the bottom of the slide and take a look. We've talked about these before. We talked about insulin resistance. We talked the beta cell dysfunction. Fertility reduced. Interesting. How many of you have encountered a woman who is obese or overweight and she has the chief complaint of, I'm not getting my periods or I can't get pregnant? Metabolic syndrome sends signals back up into the pituitary gland that can disrupt the FSH, follicular stimulation hormone, to the ovary so you don't produce an egg. We have endothelial dysfunction, which is your inflammation, and then we get cardiac dysfunction, which is the endothelial inflammation of the coronary blood vessels, the lay down of plaque, and then we get the clot formation eventually. Going deeper, if we don't take care of this problem, we will develop diabetic nephropathy because the inflammation will kill the glomerulus. We will develop diabetic retinopathy because the sugars and the inflammation will cause damage to the nerve. We get damage to the nerves in the periphery, and then our skin becomes affected and we have impaired healing processes of the skin. Pretty impressive slide, but it says it all. So in looking at complementary treatments, what are some things that we can do when we work at this whole process? Well, we know that underlying obesity, which leads into metabolic syndrome development, which leads into osteopathic changes, which leads into hypertension, diabetes, cardiovascular disease. We have other elements that interplay in. We know that we have to have proper nutrition, we have to have balance of physical movement, and we have to have stress management. So over to the right, this was from 2012. And it really hadn't changed any when I checked. The one thing that did change was the yoga, tai chi, and gaigong. That actually is now up at the top, and the natural products are just right underneath it now. But when we start looking at complementary ways to help our body be as healthy as we can and to reduce those oxidative stressors that we're doing, we have a tendency as humans to look at herbal products, which are great. Vitamin and minerals have their place, but the body is only going to use so much. If we truly are engaging in a balanced nutrition, we shouldn't need additional vitamins and minerals. Probiotics, we're going to talk a little bit about probiotics. Probiotics help to keep our gut biome intact and healthy, which then supports the neurotransmitter function in our brains and the mind body practices, which we all have learned how important these are. So, in relationship to mind body practices, we've got yoga. They're listed here for you. A lot of you are hearing about the apps that are out there, and these are the two most common ones, the Headspace and Calm. I did a lot of research prior to bringing up today's lecture for you, and Headspace actually is being reported to be a better product to help with mind body than Calm. And the reason it's a better product is because of the way that it works with different levels of individuals to help guide them into that mind body continuum of relaxation. Both of them are excellent. Both will do the same job. It is truly a personal preference. Meditation is amazing, and part of yoga is meditation, but a person has to be able to release in order to engage in these, and some people can't. Acupuncture is going to change energy flow in the body based upon grids. I really believe in acupuncture. I've seen some amazing things occur. Hospitals are using a lot of acupuncture post-operatively and for acute pain management and nausea. And these are being instituted through the anesthesia department. Tai Chi is a beautiful mind body, but also a physical activity because of the way the body moves and the focus of that movement. It really does help that person move into a mind body experience of calm and mindfulness. Mindfulness is hard to do. And again, you have to release to go into it. But just taking maybe 1 or 2 minutes and just thinking before you speak or thinking before you act, or just take 2 minutes before you go to the next thing. Allow that mind to have nothing to do but a moment of nothingness, and it can help to reset itself. When we look at the natural products that are being used right now, the number one product still being used today is the omega-3s. And the reason, we'll talk a little bit more about this, but the fish oil omega-3s, because of how they work on the endothelial inflammation, that inflammation process, as you had heard me talk of earlier, is a big component of the disease processes inside the human body. We can get that inflammation down. We can keep the disease processes from hopefully occurring. Glucosamine and chondroitin. I can tell you that there is mixed evidence on glucosamine and chondroitin. You do have to take it for 3 to 6 months for it to really be effective. But people do believe in it, and it's supposed to help to stabilize out the cartilage tissue and allow the body to rebuild it. And again, there's mixed evidence that it does. The probiotics and prebiotics, this is having a humongous impact, and this product is probably going to move up in front of glucosamine when the next run comes through of data. And the reason that I'm saying that is that prebiotics and probiotics right now, the research that is being done on the gut biomes are demonstrating that if there is an imbalance of the biome, it will lead into the development of disease processes, and it is being highly linked into mental health disorders. So probiotics are a good thing. Then we have melatonin, coenzyme 10, echinacea. With echinacea, we all know that, well, we may not all know, but I believe that you know that echinacea is one of the main herbal products that people are encouraged to take to help support their immune system. That is true, but people who have thyroid disorders should not take echinacea because echinacea can actually interrupt the absorption of their thyroid supplements and actually cause them not to have proper metabolism of the drug, and therefore their TSH levels will become high when we don't want them to be high. So remember, what with thyroid, you want them down between the ones and the twos, and by taking echinacea, they could go up to 4 or 5 or 6. So we talked a little bit in the nutrition about inflammation and the importance of using nutrition and ways to use nutrition to combat inflammation. There are different types of food products that we can eat that will really help us maintain strong vitamin levels in our body. Vitamin A is highly important. It is a strong antioxidant and it really helps that body fight those free radicals. We can eat a lot of spinach, we can eat our carrots, we can eat parsley. I'm not sure how many of you want to eat a dandelion, but they're in dandelions too. Our vitamin B complexes, these are really good. People who have high C-reactive proteins, those are linked into inflammation. We can help to work on that inflammatory process by having them eat some dark leafy vegetables. They can use vitamin B complex supplements, but not as good as having a better diet because diet has been found to be 75% associated with inflammation in the body. Change the diet, reduce the inflammation, get that down first, and then see if a supplement is still needed. Vitamin C is one of the most common vitamins that we see supplemented, and the reason it's so popular is it does a lot of different things. One, it really does support that immune system. Number two, it does help our body rid itself of the free radicals that we produce through stress, thus reducing our inflammation inside of our bodies. It also can help lower that C-reactive protein. But remember, with vitamin C, just like with your calcium, the body is only going to absorb as much as it needs to get itself to its saturated level, and then it will release the rest of it. You see vitamin C in a lot of women's facial products because of its free radical capabilities, and this works on reducing inflammation in the tissues of the face, so red spots can become less red, and it reduces the puffiness as well as smoothing out wrinkles. Vitamin D also working to help reduce inflammation. Vitamin E, about 1,000 units a day is what we typically, if somebody isn't eating the proper amounts or getting it in their diet. And then vitamin K can also reduce inflammatory markers. So the little picture I have on the left just gives you a couple ideas of where this food lies. But if you look at the food products, if we're truly eating a balanced diet, we may not need to use these type of supplements. Turmeric is actually a really cool product, but the turmeric does need to be combined with curcumin in order for it to be truly effective and to get the high level of inflammation that our individuals would want to engage in. You do need to take this for about between 3 weeks and a month before the effects will really be seen. It does help reduce the inflammation associated with osteoarthritis, and it can help with rheumatoid arthritis inflammation, but it will not retard the cellular destruction of the joint in association with rheumatoid arthritis. It also works to reduce inflammation of the endothelial lining, and it works on reducing oxidative stress. So taking this, it does need to be taken twice a day, morning and evening. Some people get a little bit of a stomach upset from it. I usually tell them just eat it with just a little bit of food. And you do need to make sure that it is standardized and it'll say that on the label that it's a standardized. Otherwise, you may be getting an unknown quantity that by the time your body metabolizes it, it is not what is reported on the label. So that would be important. So people are able to lose weight and reduce their inflammation, help to reverse the four components associated with metabolic syndrome. But in order to do that, they have to do changes themselves. Now, I know that everybody is the person that cooks in the house, but that means involving the family. And when we have people with chronic diseases, you do want to make sure that you involve the family in their care. So improve your cooking skills, eat higher quality protein. Higher quality, so fish and chicken, little bit of the red meat. Pork is okay, but we also have proteins that are plant-based, as we talked about in the nutrition lecture. More fiber. Take a prebiotic, and there's a prebiotic probiotic mix. Culturelle is one of the best ones on the market. It is pricey, but it really does have the biomes that we need in our gut that we destroy every day through what we eat and through our stressors. People need to have at least 6 hours of sleep. Vitamin D, people can obtain through a good diet, eat smaller portions of food, so on and so forth. All of this on the right is lifestyle change. It's not rocket science. The problem is that people are unable to engage in the element of time. And you have experienced time and you've spoken to me about time in relationship to I don't have it to keep myself healthy. Well, you have choices and so do our patients. You can spend a little bit more time helping them understand a small change to start, and then it leads to bigger changes. Can literally mean the difference between life and disease. So cholesterol reducing complementary treatments, niacin, vitamin B3 over the counter. In nutrition, we talked about soluble fibers. Psyllium is the best. Metamucil is actually the best psyllium product on the market. Benefiber, it actually doesn't do as great a job in inhibiting lipid absorption. Plant sterols, your soy, your flaxseed, your olive oil, cooking with it, but cooking with it in a manner that is healthful. Artichoke leaf extract, this is actually a herbal supplement taken twice a day. And I know that some of you may have heard about using red yeast rice, and that red yeast rice metabolizes into lovastatin. Red yeast rice, and I can't say that fast because my tongue gets slipped up on it. It can and it does, through metabolism in the liver, convert into lovastatin, but it does do that at extremely low amounts, and it isn't really enough for a person to lower their cholesterol when their numbers are quite high. People also can have GI issues when taking red yeast rice, and they can have reactions to this. Second. So the Nordic Naturals, this is actually made from fish products. Okay. This is a really good product, you guys. It's really a good one. The other one, oh, I can't think of the name right now. It's in a brown bottle. Um, I'll have to post that for you. I can't think of it, but it's about $45, $50 a bottle. You can get omega-3s like at Sam's Club and at Costco, and you're seeing them cost $26 or $30. Those products may not be as standardized as they need to be in order for them to do what I'm sharing with you in omega-3. Why sometimes paying the price for a better product is worth it. So with respect to omega-3s, the FDA has a couple of statements I want you to be aware of. The FDA says it has inconclusive evidence that using omega-3s are helpful in reducing coronary artery disease. And it also has stated that for people who want to lower their cholesterol levels, The AHA recommends 2 to 4 grams a day, and it needs to be the EPA plus the DHA, which we talked about in the nutrition class. And I will tell you that going back to the Nordic Naturals, the 2000 milligram omega-3, that bottle is $76. You can get this as prescription. A lot of insurance companies will not cover it. They would rather you take a statin than using this type of product, and they will cover a statin, but not necessarily omega-3. We have some alternative treatments that we're able to use with diabetes as well. Cinnamon is one. Apple cider vinegar. Drinking the vinegar tastes disgusting, but there are apple cider capsules. They do need to be standardized, and you do need to be careful with the apple cider vinegar because the apple cider vinegar will change the pH of the small and the small intestine. And when you change that pH of the small intestine, it can affect how other medications are absorbed. And a lot of times it actually increases the absorption. So you're going to get more drug circulating than you want. So it can actually cause people to have higher levels of medications in their body. So for instance, with thyroid medication, apple cider vinegar does absorb a lot more of the thyroxone from those products, which then sends a negative biofeedback um, to the brain. You get higher T4 levels, and your TSH level begins to fall. So let's say that person was running normally about 2.1 or 1.8. They're absorbing so much more of the levothyroxine that their thyroid gland actually the number starts, your TSH starts to fall. So it can go to like 0.8, 0.67. So the number really becomes significantly suppressive. Acupuncture, we talked about mindfulness, other different things that people can take to help with diabetes. All of this is over the counter. I've seen every single one of these products at Sprouts. You do have to be careful with these though. I just did a research project on bitter melon. It's also called bitter orange. That product I would highly stay away from. There's a lot of adverse reactions that occur within the body. The alpha lipolytic acid, that's actually a pretty good one. So is the chromium. Magnesium is amazing, between 350 and 500 milligrams BID. That particular product is really supportive of the neuro system and the integrity of the neurons. Ginger is a stimulant, so is garlic and coffee. What else have I learned about these things? Milk thistle, interesting product. People have a tendency to have quite a bit of reaction to that. But these are other products that are available. I'm not going to get too into the weeds, pardon the pun, in association with these. These are all actually quite complex herbal products, and each of them has benefits and contraindications to their use. I would make sure that if your patient is using any herbal product, that you ask them what it is and how much, and you do your research to make sure that there isn't any interaction occurring with any other meds that they could be taking. One of the most important things that is coming forward today is the use of technology in supporting health promotion and prevention. Every year, the data and the accuracy of that data becomes more accurate and verifiable. A lot of monitoring devices that people are using to provide their providers with evidence of how they're doing, symptoms they're having. And technology is literally flipping healthcare on its edge, not just telehealth and doing telehome care and things like that, but the actual devices that people are able to utilize at home to gather data to help their providers make better decisions. And it doesn't cost the patient as much money as going through testing through healthcare systems. So there's a controversy there because of that happening, but it is the reality of what is occurring. So this is what digital health is. It's not going away. It's only going to become more ingrained and embedded in primary care. There's a lot of different monitoring devices that are out there. The Spree, this is a monitor that does all your vital signs, heart rate rhythm, and the physiological biomarkers, SaO2, and it reports it directly to the provider. If the person starts having sinus tach with SaO2 changes, they have someone call their home and they're asked to go to the emergency room. Happify is a cool program. It's an emotional well-being program. It does cost money. It's not free, but the information is then easily transmitted to the provider to know how that patient is doing with their mental health, especially if they have depression and they're working with a therapist. And then CardioWell is a hypertension management program. Again, it's tracking EKG, blood pressure, looks at stress markers as well. And then it lets the person know when they're having a lot of stress because of the tension that's occurring subcutaneously. It also will notify the provider that something is happening. HealthWatch 360. This is an amazing website. I'd encourage you guys to go take a look at it. It is amazing. It has so many things that could be helpful to a person. It is another one that is free. U-Shield, another health program. It helps detect risk detection and educate the patient. It's a conscious raising tool for people. So they do their risk assessments, find out what their risk is, and then the app helps them devise changes and then helps them track those changes for their health. There's a lot of fitness apps and health apps that are out there today. You're hearing a lot about them. Here's just a couple that I pulled off the web of the top 20 health and fitness apps that are out there right now. Headspace, no surprise with everything that happened with COVID. MyFitnessPal, in a couple of the sites, I actually saw MyFitnessPal be rated number one for a couple different things. It was rated number one for tracking ability, for nutrition tracking, for exercise, and the premium was the number one rated program that is out there today. Best heart tracking program, Apple Watch with its AFib capabilities, the Fitbit Sense was rated like 4 or 5 down on the list. We have activity trackers that are out there. We've got music that's out there now for people to work out with. And that music, that workout music, is very specific to raising the heart rate, holding it up there, taking them up and bringing them down. So it's strategic and it's based on evidence in relationship to heart rate rhythm and maximization of burn, as well as what needs to be done after you reach high levels and bringing that heart rate down slowly into a normal rhythm.